Hello everyone, and welcome back to the Heart Smart channel. Today, we have a critical topic to discuss, one that could potentially save lives. We'll be diving deep into how a heart attack occurs, followed by the top 10 warning signs that it might be happening to you or someone you know. And most importantly, we'll share what you should do immediately if you suspect a heart attack. Please watch till the end of the video for all the important information. The information provided in this video is for educational purposes only, and not a substitute for professional medical advice. Now let's dive right in and talk about the top 10 signs of heart attack. But first, what is a heart attack? A heart attack occurs when there is a sudden blockage of blood flow to the heart muscle, usually caused by a blood clot in one of the tiny arteries on the heart called coronary arteries. The block is the result of plaque formation in the process called atherosclerosis. This blockage prevents oxygenated blood from reaching the heart muscles. Denying the heart muscle oxygenated blood is like running an engine without gasoline. The engine will slow down and eventually stop for lack of energy. Remember, the heart is a muscle that has to work all the time. It doesn't stop even a minute for refueling. The heart muscles begin to die if they are starved of oxygen-rich blood. This is called myocardial infarction or heart attack. So how can you tell that you or someone near you is having a heart attack? Sign 1. Chest pain. The first and most common sign of a heart attack is chest pain. It is the classic sign of heart attack. It is often described as pressure or tightness around the middle of the chest. Some may also feel a squeezing or discomfort in their chest, like an elephant is sitting on it. This tightness can progress to radiate to the arms, shoulders, and neck. So how and why does this pain occur? Well, let's take a look. When any of the tiny arteries, also called coronary arteries, that supply this oxygen-rich blood to the heart is blocked, blood flow to the specific region of the heart is severely reduced or completely cut off. As a result, the heart muscle in that area is deprived of oxygen, causing the cells to begin to die. The dying heart muscle sends pain signals to the brain, resulting in the sensation of chest pain. Though it is the most common sign, it's important to note that not everyone experiencing a heart attack will have chest pain, and symptoms can vary between individuals. Chest pain during a heart attack is a medical emergency. Now, since not everyone will experience chest pain during a heart attack, let's look at some of the other signs. Sign 2. Shortness of breath. Feeling short of breath or gasping for air can be a significant indicator that the heart muscles are struggling to pump oxygenated blood. The shortness of breath is due to the heart's inability to pump enough oxygenated blood to meet the body's demands. As the heart muscle becomes starved of oxygen, it struggles to function effectively, and its ability to pump blood efficiently is compromised. This reduced pumping capacity can lead to a decrease in blood flow to other parts of the body, including the lungs. The lungs may not receive enough blood flow to perform their oxygenation process adequately. This results in a decreased supply of oxygen to the bloodstream, leading to a feeling of shortness of breath or difficulty breathing. The body's response to reduced oxygen levels is to increase the respiratory rate to try to compensate for the lack of oxygen. However, despite the increased breathing rate, individuals may still feel like they are not getting enough air. Shortness of breath during a heart attack is often accompanied by other symptoms, such as chest pain and discomfort in other areas of the body. Sign 3. Cold sweats. During a heart attack, cold sweats can occur as a response to the body's autonomic nervous system reacting to the stress and lack of oxygen supply to the heart. This triggers a series of events in the body, including the activation of the sympathetic nervous system. The sympathetic nervous system prepares the body to deal with a stressful situation, leading to an increase in heart rate, blood pressure, and the release of stress hormones like adrenaline. As the body's fight-or-flight response kicks in, the blood vessels near the skin constrict, reducing blood flow to the skin's surface and causing the skin to become cool and pale. At the same time, the sweat glands are activated, leading to cold sweats as the body tries to cool down. Cold sweats during a heart attack are often accompanied by other symptoms, such as chest pain, shortness of breath, and discomfort in various parts of the body. If you are enjoying the information, please like and share the video. Don't forget to subscribe and click the notification so that we can continue on this journey of heart health together. Moving forward to the fourth sign of heart attack. Abdominal pain. Abdominal pain during a heart attack can occur as a referred pain sensation. In the case of a heart attack, a lack of oxygen supply to the heart muscles triggers nerve signals that may be perceived as pain in the abdomen. The heart and abdominal region are both supplied by nerves that transmit pain signals to the brain. However, these nerves can sometimes be interconnected, leading to a phenomenon known as visceral somatic convergence. This convergence means that pain signals from the heart can be perceived as originating from the abdominal area. Think of it as the brain is confused about where the problem is located. As a result, some individuals experiencing a heart attack may feel pain or discomfort in the abdomen rather than the classic chest pain. This abdominal pain can manifest as a sensation of heaviness, pressure, or discomfort in the stomach area. It's crucial to know that not all heart attack cases involve abdominal pain, and symptoms can vary between individuals. Also, this sign may not occur alone. It may come on with some of the signs already discussed. Sign 5. Nausea or vomiting. Nausea or vomiting during a heart attack can be a result of the body's physiological response to the stress and lack of oxygen supply to the heart. While nausea and vomiting are not as commonly associated with heart attacks as chest pain or shortness of breath, they can still occur due to the complex interplay of the body's nervous system and hormones. The exact mechanism behind nausea and vomiting during a heart attack isn't fully understood, but it is thought to involve the activation of the sympathetic nervous system. This activation can lead to a decrease in blood flow to the digestive system, which can result in nausea and an upset stomach. Additionally, the release of stress hormones, like adrenaline, can contribute to these symptoms. It's important to note that nausea and vomiting during a heart attack can vary between individuals, and not everyone will experience these symptoms. They may occur alongside other classic symptoms like chest pain, shortness of breath, and cold sweats. Sign 6. Lightheadedness or dizziness. Lightheadedness or dizziness during a heart attack can be attributed to the disruption of blood flow and oxygen supply to the brain. The heart's pumping ability is compromised during a heart attack, which can have a cascading effect on the rest of the body. One of the consequences is a decrease in the amount of oxygen-rich blood that is pumped to the brain. The brain requires a consistent and sufficient supply of oxygen to function properly, and any interruption in this supply can lead to lightheadedness or dizziness. During a heart attack, the autonomic nervous system may respond to the reduced blood flow and oxygen supply by triggering certain responses, including the dilation or relaxation of blood vessels in an attempt to maintain blood pressure. This dilation can lead to a drop in blood pressure, which may result in lightheadedness or dizziness. Moreover, the release of stress hormones, such as adrenaline, in response to the heart attack can further contribute to feelings of lightheadedness. Adrenaline can cause blood vessels to constrict, potentially reducing blood flow to the brain and exacerbating dizziness. It's important to recognize that lightheadedness or dizziness during a heart attack can occur alongside other symptoms, such as chest pain, shortness of breath, nausea, and cold sweats. Sign 7. Fatigue. Fatigue is a common symptom of a heart attack and is often described as an overwhelming sense of tiredness or weakness. Fatigue during a heart attack can be a result of the body's response to the stress and physiological changes that occur when the heart is not receiving adequate oxygen supply. During a heart attack, when blood flow to a portion of the heart is compromised, the heart's pumping efficiency is decreased. As a result, the body may not receive the necessary amount of oxygen and nutrients it needs to function optimally. It can be caused by several factors, including decreased oxygen supply, metabolic changes, and heart muscle damage. It's important to note that fatigue during a heart attack may occur in conjunction with other symptoms such as chest pain, shortness of breath, lightheadedness, and cold sweats. Sign 8. Indigestion and heartburn-like symptoms. Indigestion or heartburn-like symptoms during a heart attack can be a result of the heart's proximity or closeness to the esophagus and the complex interaction between the two. The heart and the esophagus share nerve pathways, which can sometimes lead to referred pain. In the case of a heart attack, the lack of oxygen in the heart muscle triggers pain signals that can be misinterpreted as originating from the upper abdomen or esophagus. This misinterpretation can lead to symptoms that mimic indigestion or heartburn. The discomfort may be felt as a burning sensation, heaviness, pressure, or discomfort in the upper abdomen or chest area. The similarity between heart attack symptoms and indigestion can sometimes lead to confusion, especially if a person is not aware of their risk factors for heart disease. If you experience indigestion or heartburn-like symptoms along with other signs of a heart attack, such as chest discomfort, shortness of breath, or cold sweats, it's crucial to seek immediate medical attention by calling emergency services. Sign 9. Pain in the lower jaw or throat. Have you ever wondered why a heart attack can cause pain in unexpected areas, like the lower jaw or throat? Let's delve into the fascinating connection between the heart and this seemingly unrelated region. The heart and the lower jaw, throat, and other areas share nerve pathways. These nerves can sometimes lead to what's called referred pain, as explained earlier. These signals can be mistakenly interpreted as originating from the lower jaw or throat. Instead, it's a result of the brain's interpretation of the signals sent by the distressed heart. Heart attack symptoms, including jaw or throat pain, often come alongside other warning signs like chest discomfort, shortness of breath, and cold sweats. Sign 10. Upper back pain and others. Pain, discomfort, or a sensation of heaviness may be felt in other parts of the upper body, including the arms, especially the left arm, the back, and the neck. The pain or discomfort in the upper back may occur between the shoulder blades. Now that we have discussed the signs of heart attack, let's talk briefly about what to do when you see these signs in yourself or someone else. Remember that what you do may save your life or the life of others. Oh, and here's the thing, heart attack symptoms can vary between men and women. Women may experience atypical signs like lightheadedness, neck pain, or arm pain, while men may experience the classic chest pain. The key is to know your body and recognize any unusual symptoms. If you suspect a heart attack, the first and most crucial step is to call emergency services immediately. Time is of the essence, and getting medical help as soon as possible can make all the difference. If you have a history of heart attacks or if your doctor has prescribed nitroglycerin to you, take it as directed. Nitroglycerin can help relieve chest pain by dilating blood vessels, allowing more blood to flow to the heart. Take the medication while waiting for emergency help, but remember to keep your doctor informed about any symptoms you experience. If you're not on any heart medication, don't wait, call for help immediately. While waiting for help, if you have aspirin available and you're confident it's a heart attack, take aspirin to help prevent further clot formation. Aspirin is a blood thinner that can help limit clot progression. Be aware of the potential side effects of aspirin, and only take aspirin if you're sure it's a heart attack. You know your body well, so if you have these signs, especially chest pain, along with any of the other signs, and you have risk factors for heart attack, you probably won't be wrong. In any event, let your doctor know as soon as possible so that your symptoms can be reviewed. Note that information provided here is not intended to treat any condition or replace your doctor's advice. Please follow your care plan for maximum protection against heart attack. Also, it's crucial to be proactive about your heart health. Prevent high blood pressure and plaque formation by maintaining a healthy diet and lifestyle. Thank you for tuning in today. If you found this video helpful, please subscribe to the channel, give it a thumbs up, and share it with your loved ones to spread awareness about heart attacks.